Good afternoon. Yep. Good afternoon, everyone. This is Osama Hamid, a bariatric surgeon from Jordan. Welcome to the fun session, the bariatric surgical Jeopardy. We've started this maybe 2 or 3 years ago, and basically, I see we're going up in the halls. Typically, like last year, we were at the side hall at the end of the meeting. Now they gave us the main hall in the first day. So I believe the IFSO leadership had decided to add this taste of fun flavor to the meeting. First, I would like to welcome our judges, Dr. Sergio, thank you very much. Dr. Shower, thank you very much. Dr. Randeep and Dr. Haddad Ashraf. This is typically runs in 2 rounds, and it's very similar to the American trivia Jeopardy, if you guys remember it in the old good days. So we have the first round between fellows. We had people signed up for this thing. And then the second round would be between consultants. And then the final round between the winner of the fellows with the winner of the consultant. And the winning team will get a free registrations for IFSO next year in Santiago. So what's the name of your team? Kangaroo. So Team Kangaroos. Okay, so we have Team Kangaroos. And what's your team name? Pyramids. What? Pyramids. Team Pyramids and Team Estrella.
Estrella da Australia.
Estrella da Australia. Okay. So our category for round 1, please. Can you click next? Can you click next, please? Categories for next. So obesity definition. Next. Bariatric nutrition. Next. Pediatric and adolescent obesity. Next. Bariatric clinical trials. And finally, comorbidities, and one more, IFSO. So these are, can you go to the home screen, please? Okay, so basically, you will choose one of these, category and the numbers. So for example, nutrition, 200, whatever. And then I'm gonna give you the hint, and you have to give me the answer in a question format. For example, you did.
I'm just checking.
You're checking. We'll make you check things. So, for example, who is the main the main author for STAMD trial? The answer will be who's Dr. Phil Shower. That's how the answer will be. Okay, so we'll start with kangaroo, Estrella, and Pyramid. Is it right? So kangaroos, can you check your buzzer, please? Good. So it's working. And Estrella, can you check your buzzers? Okay, it's working. Pyramids, can you check your buzzers? Okay, easy on the buzzer, so it can go to the next session, to the next round. Okay, again, this is fun. The winning team of this fellows will compete with the consultant in the final round. So we have 3 rounds, fellows, consultants, and then fellows against consultants. We'll start with the kangaroos. Can you please pick and choose a category and a number? Okay, what's on the mic, please? You have mics. You guys have mics.
Category would be comorbidities.
What was that again?
Comorbidities.
Which number?
5.
What? 500? Can you stop the music, please?
$100.
Okay, so comorbidities 500. So
$100.
100?
Yeah.
Okay, too late.
Sorry.
So comorbidities 500. So this is a daily double. If you answer, you'll get a positive 1,000. If you get it wrong, you get a negative 1,000. But then you have to, once you see the answer, you have to push the bottom. So if you know the answer or not. Give us the question, please. Next. Human relationship that might be affected positively or negatively after bariatric surgery. Pyramids, can you answer?
Marriage and divorce.
What is marriage and divorce? You have to answer in a question format.
What is marriage and divorce?
That is correct, and you get 1,000. Correct. Yalla, clap for them. Good job. Okay, go to the answer question. Go to answer. We'll go with pyramids again. Can you pick and choose a number and a category? On the mic, please.
Nutrition 400.
Nutrition 400. The earliest sign of inadequate protein intake post-bariatric surgery. Okay, pyramids.
Hair loss.
Again, you have to answer in a
What is
question
hair
format.
loss?
So we have a judge here.
Yes.
So
He did not answer with a question.
he lose.
He loses.
Okay, so you lose 400. You have to answer in a question format. So what is hair loss? Okay? So we have a judge here. So you have to answer in a question format. What is persistent hair loss? Can you go to the answer, please? Okay, what is persistent hair loss? Go to the home screen, and the pyramid lose 400. So you have to have minus 400. It's gonna be hard if you. It's not working. The score sheet. It should be easier.
We should finish.
What's that?
One.
Okay, pyramids. You are the one who had the last correct answer. Can you pick and choose again? You guys you can press the bottom if you know the answer. Go ahead. Choose.
Choose what?
Choose a category and a number.
Obesity definition 100.
Obesity definition 100. The year the American Medical Association designated obesity as a disease. Who had Estrella? Go ahead.
Was it in 1998?
That is incorrect.
That's
So you
incorrect.
lose 100.
It's 2011.
Any taker? Any taker? You can
When-
push the
which
bottom
year?
if you know the answer. You can push the bottom if you know the answer. You can push the buzzer, kangaroo or pyramids. No? Any takers from the audience? The year the AMA designated obesity as a disease. The answer is what is 2013. So we have the Australia minus 100, please. Okay. We'll reset the bottom, and then we'll go to, again, pyramids. You are the one who got the right, yeah.
Don't we get to know the answer?
What's that?
What was the answer?
2013. What is 2013?
Okay.
What is 2013? Okay, pyramids, again, you have the mic.
Comorbidities 300.
Comorbidities 300. Obesity is the most important risk factor for these two cancers in postmenopausal women.
What's the breast cancer?
Okay, you have to hit the buzzer, and then I'll give you the green light to answer. So kangaroos, go ahead.
What is breast cancer and endometrial cancer?
That is correct. So kangaroos get 300. Good job.
We pressed before them.
What was that?
We pressed before them.
Well, it did not get your breast. You can check your buzzer now. Check it. So it's working. So you can't tell me it's not working. Okay. Keep. Okay. Go back to the home screen, please. Okay, kangaroos, pick and choose, please.
Comorbidities 200.
Comorbidities 200. The first sign of obesity-related chronic kidney disease. Okay, kangaroos.
What is proteinuria?
That is correct. That is correct. Good job. Good job. So he get, it was 100, 200, this one. Back to the home screen, 200. Yeah, good, 500. Okay, it's back to the home screen. Yeah, kangaroos, can you please choose? Yeah.
Comorbidities 400.
Comorbidities 400. This syndrome in obese individual characterized with daytime CO2 level more than 45 and sleep disorders. Go ahead, pyramids.
What is hypoventilation syndrome?
That is correct. That is correct. Good job. What is obesity hypoventilation syndrome? Good job. Good job. Okay, pyramids. So you get 400 pyramids. Okay. Pyramids. Choose.
Nutrition 300.
Nutrition 300. Deficiency results in confusion, peripheral numbness, pain, and sometimes paralysis. Kangaroos. In a question format.
What is thiamine deficiency?
That is correct. What is thiamine deficiency? That is correct. Good job. Good job. So you get 300. Kangaroos get 300. Okay, kangaroos, go ahead. Choose from the home screen, please. Choose, yeah.
Nutrition 200?
Nutrition?
200.
200. Deficiency can cause poor wound healing, hair loss, glossitis, acrodermatitis, and enterohepatic-like rash. Pyramids.
What is zinc deficiency?
What is what?
Zinc deficiency.
That is correct. What is zinc deficiency? That is correct. Good job. Good job, pyramids. Pyramids. Okay, pyramids. Can you choose?
Nutrition 500.
Nutrition 500. Deficiency results in microcytic anemia, neutropenia, peripheral neuropathy, myelopathy, ataxia, muscle weakness, optic neuropathy, and cardiomegaly. Any taker? Okay, kangaroos. What is?
What is vitamin B12 deficiency?
That is incorrect. So, any takers? Okay, we have pyramids.
What is copper deficiency?
That is correct. What is copper deficiencies? Good job, pyramids. Okay, pyramids. You have the screen and mic. Pyramids. Choose.
Nutrition 100.
Nutrition 100. Post-operative supplementation of this essential amino acid results in maintenance of muscle mass, stimulation of protein synthesis, and improvement body composition. Any taker? Okay, kangaroos.
What is glutamine?
That is incorrect. So you lose 100. Good job, minus 300. Keep going and you will... Any takers from the audience? Any takers? What is leucine? What is the answer is what is leucine? Leucine. Yeah, leucine. Leucine. Go back to the home screen. Last one answered correctly was the pyramids. Can you pick and choose, please? So Estrella, are you guys? Can you check the green the buzzer? It's working. Why you're not pushing it? You know? Okay, pyramids.
Obesity definition 500.
Obesity definition 500. BMI definition of obesity in children. Okay, Estrella.
What is over the 90th centile?
95th percentile of the BMI. I will take it. That's correct. Good job. Good job. So we'll get you into the game. So what is the BMI more than 95th percentile of the age percentile chart? That's correct. Good job. Australia. Yeah, she's now get excited. Good. Yeah, on the mic, please.
Obesity definition 400.
Obesity definition 400. Waist circumference to define obesity in Caucasian female. Okay.
88 west.
Can you that's answer to the
What's 88 circumference?
what is 88 centimeter? That is correct. Good job. Which is 35 inch. Good job. Good job. Did you read this just like a second ago, or that's what you use in your? Just okay, pyramids. We have pyramids on the mic. Pick and choose, please.
Obesity definition 300.
Obesity definition 300. Percent body fat required to define obesity in men according to Obesity Medicine Association, Australia.
More than 25. What is more than 25? BMI.
No, that's incorrect. That's incorrect. Any taker? That's incorrect.
It's percent. What is 25%? I'm sorry, I said BMI.
Any taker from the other team players? So the correct answer is what's 30%. It's 30%, not 25%. 25% it's overweight. I'm sorry. Okay, so what is 30? More than 30%. We'll go back to permits. You guys had the last correct answer.
IFSO 400.
IFSO 400. IFSO 400. The first female president of IFSO. Come on. Okay, Australia.
Who is Dr. Wendy Brown?
That is incorrect. That is incorrect. So you lose. So you decided to stay in the minus. That's good.
Revoke their membership in IFSO, Stephanie.
The first female president of IFSO. Australia. You should know it. You should know it.
Lillian Chow.
That you know.
Say a question.
Didn't answer in the question format, so you lose.
Who's Lillian Chow?
You gave the hint.
What's that?
You gave them a hint.
But again, he's from Australia.
Who is Lillian Chow?
But you lose. We have the judge said you didn't answer in the question format, so you lose. So you lose. So the answer is who's Dr. Lillian Cow?
Gentlemen, should we be easy or what? Confirm, should we? Give it to him or no?
No. Okay, the last one who answered correct, I think, is permits again.
IFSO 300.
IFSO 300. City and year where first IFSO Congress was held. First IFSO Congress. So we are here, you should know about the history of IFSO, and that's any taker? Yeah, go ahead. Your case will allow you. You have 1800. Go ahead.
Braga 1996.
What was that?
What is Braga 1996?
Prague
1996.
1996.
Yes.
That is correct. What's Prague 1996? Good job. Good job. So you got it. Good job. You get 300. So Prague 1996. Okay. Permit. Can you choose?
What is Trials 200?
What's that?
Trials 200.
Trials 200. In a randomized trial by Rubino, this procedure had the highest rate of remission of type 2 diabetes. Any taker? Kangaroos. Australia. Okay.
What is a laparoscopic Roux-en-Y gastric bypass?
What was that?
A laparoscopic Roux-en-Y gastric bypass.
That is incorrect. It was one of his land. Okay, permit.
What is Didenal switch?
What is?
Didenal switch.
What do you guys think, judges? Want to take it?
Biliopancreatic diversion with Didenal switch.
So we have a judge here. You can speak on the mic, sir.
The judges collectively say no.
No, so you lose. So it's what is biliopancreatic duodenal switch, not only duodenal switch, okay? So that is incorrect, okay? So go to the answer and then go to the home screen. So what is biliopancreatic divergent duodenal switch? Okay, so go to the home screen, please. Oh, go ahead.
But if you're in wrong, you have to do what the wrong do. You're in Melbourne, we call it duodenal switch. We don't call biliary pancreatic duodenal switch.
So
The jury has spoken. The investigators in that trial called it biliopancreatic diversion. It's not a duodenal switch. Nice try.
I like it. So, you know, again, this is a scientific term. It doesn't, we don't care what you guys call it in Melbourne, okay? So what do we call it worldwide? Or maybe if you're in Melbourne, do what the Melbournes does, is that? Okay, so again, who had the last correct answer? Permit, we are the mic with you.
Trials 300.
Trials 300. The first long-term observational and longitudinal study to evaluate bariatric surgery in adolescents. So again, these, I think, landmark studies, you should all know about it. Any taker? Kangaroos. Very famous, Thomas Inge. No? Any takers from the audience? What is the Teen Lab study? The Teen Lab study. The teen lab. So go to the answer. So what is the teen longitudinal assessment of bariatric surgery, the teen lab study? We'll go to the home screen. Permits, still the mic with you.
Pediatric obesity 300.
Pediatric obesity 300. Most performed bariatric procedure in adolescents nowadays. Okay, kangaroos.
Sleeve gastric. What is sleeve gastrectomy?
What is laparoscopic sleeve gastrectomy? That is correct. Good job, kangaroos. So now you are 0. Good job. You know. Okay, go back to the home screen. Kangaroos.
Pediatric obesity 400.
Pediatric obesity 400. Most performed bariatric procedure in the teen lab study. Okay, kangaroos.
What is sleeve gastrectomy?
That is incorrect. Any takers? So no, you got minus now. So you insisted to go up and then go down. So kangaroos lose the point of this. Kangaroos lose. You had to put minus for kangaroos. Any takers? Pyramids.
What is lap adjusted gastric
What's
band?
that?
What is adjusted gastric band?
That is also incorrect. So also you lose. Anyway, Australia.
What is the laparoscopic Roux-en-Y gastric bypass?
That is correct. Good job. Good job. I don't think anything left over, you know? Good. Good job. Okay, so Australia, the mic with you.
Obesity definitions for 200, please.
Can you put in the mic, please?
Obesity definitions for 200, please.
Obesity definition for 200. BMI definition of obesity among Asians, Australia.
What is 27.5 BMI?
Judges? That is incorrect. So you lose. Okay. Okay, kangaroos.
What is 27.5 with comorbidities and 32.5 without comorbidities?
No, we're talking about definition of obesity. We're not talking about indications.
What is 32.5 kilogram per meter square?
That is incorrect. Okay,
What is 27.5 BMI?
it's 28. Want to take it? I think it,
27.5.
so, but they got an answer, the 28, the more than 20, 28 and above.
7.5, that's what it is.
So Asians is different than Indians. So Asians, the Japan and China, 28. Indians is 27.5.
We have 4% of Indians.
So you guys, judges, you can figure it out. But I think the Indians is different than the Asians. Okay. So you can get yeah.
The Asian is 27.5 BMI.
So the Australia get the numbers. Australia, that's correct.
Did they say 27.5?
Yeah,
They
they
said
said
27.
27.5, she said.
They said 0.5?
Yeah. So Australia get the numbers, and then we'll continue. Australia. So the Australia, they win the points of this question.
As a point of clarification, we've had 200 taken away from that as a result of that incorrect answer. I would like our score to reflect our actual score.
What was that again?
I would like our number to be higher, please.
I can't.
Thank you.
I can't answer. I can't hear you for some reason. You know. Okay, Australia, you have the mic with you now.
Pediatric obesity for 200, please.
Pediatric obesity for 200. This bariatric procedure was studied in a randomized trial in adolescents. Can you please hit two click? Okay, go ahead. Kangaroos. Randomized trial.
What is Roux-en-Y gastric bypass?
That is incorrect. It's the only one that's studied in a randomized trial. It's rarely used nowadays. Okay, Australia.
What is gastric sleeve gastrectomy?
That is incorrect. So you lose. Any takers, permits? Okay, permits.
What is lab gastric band?
That is correct. What is the lab band? The lab band trial. It's rarely used nowadays. Okay.
Paul O'Brien and John Dixon. Paul O'Brien and John Dixon, Australians did that study.
Australian, yes. It's done in Australia here. Okay, is permits.
Comorbidities 100.
Comorbidity is 100. Strongly related to obesity. Okay, go ahead.
What is steatohepatitis?
No, he has it, sorry.
What is non-alcoholic steatohepatitis?
That is correct. Steatohepatitis or MASH. Good job. So you get the points. Kangaroos. Kangaroos.
Pediatric obesity 500.
Pediatric obesity 500. 5 FDA approved medications for obesity treatment in adolescents. So what are? Actually, there are 4. You can argue about 5. Any takers? FDA approved medications for treatment of obesity in adolescents. Permits. I can say just one. No, this one's not enough. Any takers from the audience? Okay, so the answer are orlistat, phentermine, topiramate, liraglutide, and semaglutide. So these are the 5 FDA-approved medications for treatments of adolescents with obesity. Next, please. Yep, go back to the home screen. Okay, kangaroos, I believe you had the right, correct answer.
Trials 500.
Trials 500. Largest and longest running trial at 12 years follow-up, metabolic surgery was superior to medical and lifestyle intervention for type 2 diabetes, control, remission, and weight loss. If you attended the session this morning, you would have known it. But you guys don't attend the sessions. You think these sessions are made just for fun. Okay, Australia.
What is best trial?
What is what?
Best trial.
That is incorrect. Any takers? Any takers from the audience? What's that? So yes, Dr. Shah is sitting here. What is the ARMS? Type 2 diabetes. Show the answer. It's Dr. Phil Shower. What's the ARMS type 2 diabetes? The Alliance of Randomized Trials of Medicine versus Metabolic Surgery in type 2 diabetes. Okay, to the home screen. Kangaroos. Yeah.
Trials 400.
Trials 400. The first long-term prospective controlled trial in bariatric surgery to assess effects of weight loss on cardiovascular disease, cancer risk, and mortality. It is the most widely indexed or referred to paper over whatever. Any takers? You cannot Google it. Kangaroo, sorry, pyramids. You can't Google it. No, kangaroos, they're Googling it. You can't use your phone. That's not acceptable. Any takers? Any takers from the audience? What's the SOS? The Swedish Obesity Subject Study Group. Guys, this is ABCs of bariatric surgery, you know? Go ahead to the answer and then to the home screen. The Swedish Obesity Subject Study Group. Again, you know, this morning we had like 5 or 6 slides from it. Can you go to the home screen, please? Okay, kangaroos.
Trials 100.
Trials 100. In this trial, a 10-year follow-up, both sleeve and bypass resulted in good sustained weight loss, more in the Roux-en-Y gastric bypass, and similar rates of Barrett's esophagus. You know, the whole discussion that sleep causes more Barrett's. This trial at 10 years showed no difference in Barrett's esophagus. Any taker? Any taker? Yeah? Nobody? You can hit the buzzer, that's fine. It's only 100. You already minus 700, so it's not going to be a difference. Yalla, any takers? Okay. So what is the sleeve pass trial? The sleeve pass trial. Go back to the home screen, please. Home screen. Any, yalla, kangaroos.
Pediatric obesity 100.
Pediatric obesity 100. Definition of severe obesity in children. Okay, kangaroos. What is?
What is percentile weight above 99%?
Above what?
99%.
That is incorrect. Any takers? Any takers? So any takers from the audience? What is more than 1/20th? What is more than, wait, I just got it. That's
What
fine.
is above 2 standard deviations above the mean?
What was that?
Above 2 standard deviations. What is 2 standard deviations? What is above 2 standard deviations above the
That's a smart way to answer it, but it's more than 1/20th percentile of the 99th percentile. What is more than 1/20th of the 99th percentile? So what, more than 20% of the 99th percentile. Okay, kangaroos.
So 500.
What's that?
If so, 500.
IFSO 500. Okay, let's see. Current chairman of IFSO Board of Trustees. Any takers? Any takers? From the audience, for the sake of time? Who's Dr. John William Grieve? Thank you. Who's Dr.? Can you get the answer? John William Grieve. He's the chair of the Board of Trustees right now. Okay, we continue with the kangaroos.
If so, 200.
IFSO 100. The city and the year where IFSO was formed. No, that was the meeting. This is the year that was. Any takers? You guys come to IFSO and you didn't have time to read about IFSO, you know, the history. These giants, what did they do to see this kind of huge success now? Any takers? So the correct answer was Stockholm, 1995. Okay, and then the last question, home screen. It is IFSO 200. The first president of IFSO. Okay, permits.
Scopinaro. Who is Scopinaro?
What is?
Who is Scopinaro?
Who is Dr. Nicolas Scopinaro? That is correct. Good job. Good job. That is correct. So you get 200. So we have now the winning team is the permits, which is around 1900s. And then we have the kangaroos minus 800 and the Australia minus 600. Thank you very much, guys. Thank you very much. We'll go to round 2 and we'll ask the consultants to come. The consultants to come, please. So we'll go to round 2, categories. Can you please show us the categories? Small molecules, endocrinology and obesity, bariatric procedures, complications, celebrities and bariatric surgery, obesity surgery journals. Okay, so we'll go with the Mediterranean. Can you please, what's that? MENA, M-E-N-A. C. MENA/C. Okay. We'll start with the Mediterraneans. Can you please choose a category and a number? On the mic, please.
So, complications, $300.
Complications, 300. Recurrent attacks of colicky abdominal pain 6 years after laparoscopic Roux-en-Y gastric bypass. Remember to answer in a question format. Okay, Mediterranean. What is?
What is internal herniation?
That is incorrect. It's right there in front of you. Okay, quality. No, you have to pick to hit the buzzer.
What are the symptoms of interception?
What?
Interception.
What is retrograde jejunal interception? Judges, what do you think? Take it?
Interception is good enough.
Okay, so interception, you can see the bullseye right there. So yes, that's correct. That's correct, quality. So the quality gets 300. Okay, quality. You have to choose a category and a number, and you should stop Googling.
300 small molecules.
Small molecules, 300. Has an exogenic effect and increased hepatic insulin sensitivity. Hit 2 clicks, please. Secreted by the pancreatic F cells. Any takers? Okay, Antonio, Mediterranean.
What is glucagon?
That is incorrect. Good job. Now minus 600. Good job, Antonio. Any takers? Secreted by pancreatic F cells. Okay, quality.
GLP-1.
That is incorrect. No, that's fine. You have lost. You have to talk to each other when you try to answer. So another minus 300 for the quality. Any takers? So the correct answer, what is the pancreatic polypeptide? Pancreatic polypeptide. Okay, we're back to the home screen, and then the last one who answered correctly was the quality. Quality, can you pick and choose? On the mic, please.
Okay, we will make it interesting. Celebrities and bariatric, $200.
Celebrities and bariatric surgery, 200. Bariatric procedure done for this celebrity to lose weight and treat his type 2 diabetes. He was a judge in the American Idol.
We don't have American Idols in Australia.
That's fine. Well, that's your problem, not my problem.
We don't have TVs in Australia.
Again, a bariatric procedure done for this celebrity to lose weight and treat his type 2 diabetes. Any takers?
What's why?
Okay.
What's Roux-en-Y operation?
That is correct. What is laparoscopic Roux-en-Y gastric bypass? Good job. See, you know it. So that's correct. Quality, pick and choose. On the mic, please.
Bariatric procedures for 300, please.
Bariatric procedures for 300. Surgeon who invented this procedure. Okay, the Mediterranean.
Well, who is Nicola Scopinaro?
That is correct. Who is Dr. Scopinaro? That is correct. Good job. So the MENA team, can you check your buzzer? Make sure it's working. It's working. Why you're not hitting it? You know?
We're waiting. Watchful waiting.
Oh, watchful waiting. Yeah. Wait till the end. Okay, we have the Mediterranean.
Obesity genetic 500.
Obesity, what? Genetics?
500.
Obesity genetics 500. Autosomal dominant disease leading to an inability to activate adenylyl cyclase and therefore causing target organ unresponsiveness to multiple hormones. Obesity genetics 500. So any takers? Can you hit 2 clicks, please? In addition to hypophosphatemia and hypocalcemia, any takers from the audience? What is Albright hereditary osteodystrophy? So the answer is, what is Albright hereditary osteodystrophy? You can go to the answer. No takers. or the pseudo-hypoparathyroidism type 1A. Go to the home screen, please. Mediterranean.
Obesity surgery journal 300.
Obesity Surgery Journal 300. Current editor-in-chief for obesity surgery. Okay, Mina.
Who is Scott Shikara?
That is correct. Who's Dr. Scott Shikora? Good job. Good job. So 300. That is correct. Good job. Okay, Mina. Pick and choose.
Obesity Surgery Journal 400.
Obesity Surgery Journals 400. Founding editor and first editor-in-chief for Obesity Surgery Journal. Okay, Antonio or Mediterranean.
Mervyn Dittel.
Who is?
Who is Mervyn Dittel?
Who is Mervyn Dittel? That's correct.
This is another game.
He gets it. Who is Dr. Mervyn Dittel? Dr. Mervyn Dittel.
I correct
This
myself.
is bias, guys.
That's bias.
It's like asking me
American European. We'll take that from you. American European.
Okay, Antonio, Mediterranean. Go ahead.
Celebrities and bariatric 500.
Celebrities and bariatric surgery 500. So this is a daily double. If you get it right, you get 1,000. If you get it wrong, you lose 1,000. Show us the answer, please. Show us the question, which is type of Roux-en-Y revision done for this celebrity. She had Roux-en-Y, she had weight regain, and then she had a revision, some sort of revision. Okay.
Type 1 distalization.
That is incorrect.
What is Sadi?
What's that?
What is Sadi?
That is also incorrect. So you guys lose 1,000 and you guys lose 1,000.
No. Mediterranean, no. Mediterranean didn't answer.
What was that?
The score is, no, we are not.
It's okay, it's all right.
No, the Mediterranean does not lose.
You have to decrease to the
The Kuala and Mina, the one that lost 1,000.
Mina and Kuala.
See, Antonio is awake.
Right.
Any takers? So what was the banded Roux-en-Y gastric bypass? Pouch revision and banded Roux-en-Y gastric bypass. Okay, the answer was, what is the banded Roux-en-Y gastric bypass with pouch revision? Go to the home screen. The one who wrote it last correct was Mediterranean. Pick and choose, please.
Please. Complications 400.
Complications 400. Cause this tachycardia pattern after bariatric surgery. Okay, Mina?
Bleeding.
What is?
Bleeding.
You have to answer in that question.
What is bleeding? Yes.
What is bleeding? That is correct. What is bleeding? That is correct. Good job. So the Mina get the answer. Okay, Mina.
Small molecule 500.
Small molecules 500. Secreted from adipocyte and macrophages has potent inflammatory effect. Can you hit 2 clicks? 2 clicks. Mediate cachexia response in cancer. Go ahead, Antonio, Mediterranean.
Adiponectin.
What's that?
What is adiponectin? Adiponectin. What is adiponectin?
That is incorrect. You lose the points. Any takers? Good job. You guys all in the negative. So, I think... Any takers? Any takers from the audience? That is correct. What is TNF? You should have answered correctly when you were up there competing. Oh yeah, I see. What is TNF alpha? That's correct. Anyway, Antonio, again, the mic is with you guys.
Complication 500.
Complications 500. Chronic productive cough after sleeve gastrectomy with chronic leak. Okay, Mediterranean.
What is sleeve bronchopleural fistula?
What is?
Sleeve bronchopleural fistula.
What is bronchogastric fistula? That is
sleeve
correct.
gastric broncho.
That is correct. Good job. Good job.
This is sleeve. What is bronchogastric fistula?
Yeah. Good job. So now you are the only one who is in the positives. Good job, Mediterranean. 100 positive. Go ahead, pick and choose.
100 positive only?
Yeah, 100 positive only. From all the correct
But it was
answers.
correct or not?
That's correct. That's correct. We get it for you. We give it for you.
Okay. Obesity Surgery Journal 500.
Obesity Surgery Journal 500. The impact factor for Obesity Surgery Journal. Go ahead, Mina C.
What is 2.9?
What is 2.9? That is correct. That's correct. Good job. Good job. 2.9, the 5-year impact factor is 3. Good job. I think you just read it maybe few hours ago, or that's something you guys...
He's an avid reader.
He's an avid reader for the Obesity Journal. Okay, go ahead.
Bariatric procedure 500.
Bariatric procedures 500. Name the procedure. Okay, Antonio, what is?
Duodenal switch.
You have to answer it in a question form.
What is duodenal switch?
I will leave it to the judges to take it or not.
What is?
So what is
You took a point from me.
What is biliopancreatic diversion and duodenal switch?
Yeah.
Biliopancreatic diversion, duodenal switch.
Duodenal switch. It's a duodenal switch.
Okay.
Pancreatic duodenal switch.
We'll take your points and give it to them if you keep on complaining.
Yeah, I'm happy with that.
Okay, we'll get to Antonio and then Mediterranean. Maybe you...
But we didn't have any point round.
No, they gave it to you.
We gave it to you.
We gave the point for
No,
the
the 100.
Mediterranean.
It's still 100. I had 100 before.
No, they give it to Kawhi.
Yeah,
Why?
it's working on it.
Oh yeah.
Good job.
Now it's correct.
Okay, Antonio.
Well, we have to taking care of the of the
Somebody's
country,
there.
right?
Somebody's there taking care of.
Okay.
Okay, maybe you can let your partner play with you, so you have the mic all the time and you choose everything and you answer.
Advise, Anton, advise. Sorry. Bariatric procedures, 400.
Bariatric procedure 400. Procedure and the surgeon popularized its use. Okay, go ahead.
What is SADIS?
What is SADI?
S.
And who's the surgeon who popularized it?
Yeah, Antonio Torres.
It was Antonio Torres. That is correct. That is correct. See?
We didn't answer, politely.
Okay, the Mina. Mina got the correct answer.
Obesity genetics 400.
Obesity genetics 400. Syndrome of obesity, metabolic disorders, blindness due to retinal dystrophy, and hypogonadism with infertility. Any takers? Any takers from the audience? That's Bardet-Biedl, that's correct. What is Bardet-Biedl syndrome? That is correct. Good job. Okay, so back to the Mina. The mic is with you.
Celebrity and bariatric 400.
Celebrities and bariatric 400. Procedure done for this celebrity in 1999. Okay.
Laparoscopic adjustable gastric band.
That is correct. What is laparoscopic adjustable gastric band? Good job. The Mina, good job. 1,000. Good job, Mina.
Small molecule 400.
Small molecules 400. Secreted from the ileal L cells, has anti-inflammatory, insulinomimetic, and anoxygenic effect. Okay, Antonio.
What is GLP-1?
What's that?
What is GLP-1?
That is incorrect.
Okay.
So you lose.
What is POY?
No, it's you get only one time to answer. So you lose. And easy on the buzzer. I had to take it for the third time. Go ahead.
What's PYY?
That is correct. What is PYY? Good job, the Mina. Mina got the correct answer. Good job. Go ahead, Mina.
Obesity genetic 300.
Obesity genetics 300. Most common form of syndromic obesity. What is what? It's very easy. Any taker? Okay, Koala team.
What is Down syndrome?
What is?
Down syndrome.
That is incorrect. So good job, Koala team. You're minus now 1,100. That's good. You have to be positive to go to the next level. Any takers? Okay, Antonio.
What is Prader-Willi syndrome?
That is correct. Good job. Good job, Antonio. That is good job. What is Prader-Willi syndrome? And yeah, go ahead, Mediterranean.
Bariatric procedures, 200.
Bariatric procedures, 200. Most common bariatric operations in 1980s. Okay, Mediterranean.
Rowan-Y gastric bypass?
That is incorrect.
I think.
That's incorrect. That's fine. You lost it. So you go up and you go down. Good job. Any takers? In the 80s. Okay.
What is
Quality.
gastric band?
What's that?
Gastric band. What is gastric band?
I'll leave it to the judges to take it or not. No. That is incorrect also. You lose.
We're not risking.
You're not risking it? Okay.
I know the answer, but I'm not risking. Can I answer it?
He's from the 80s. What's that?
Vertical gastroplasty.
That's good. That's correct. What is VBGs? What is vertical banded gastroplasty? Okay, go ahead to the home screen. I think the last one who had the correct answer was the Mediterranean. Can you please pick and choose? Mediterranean. Antonio and your friend.
Please. Complications, 200.
Complications, 200. Abdominal pain, nausea, and vomiting 3 weeks post-sleeve gastrectomy. You have the CT scan in front of you. Any takers? You can hit the buzzer if you know the answer. Okay, Antonio.
What is sleeve stenosis or torsion?
That is incorrect. Any, go ahead.
What's portal vein thrombosis?
That is correct. You can see the portal vein is thrombosed right there. Good job. So the Koala team is correct. Sorry, the Mina correct. Go ahead, Mina.
Celebrity and bariatric 300.
Celebrities and bariatric procedures 300. After suffering from this obesity-related comorbidity, at age 50, this celebrity had laparoscopic sleeve gastrectomy. So what kind of complications of obesity she had and made her to have a surgery? What complications she had? Any takers? So the answer is, what is heart attack? She had a heart attack and made her have the surgery. So what is heart attack or coronary artery disease? Okay, go ahead to the, again, I think the Mina.
Yeah, obesity surgery journal 200.
Obesity surgery journal 200. Year of first edition of obesity surgery journal. What's that? He must know. He's the youngest among you guys. He's the youngest. When was the year of the first edition of obesity surgery journal? What is 1991? That is correct. Khalid, you're not playing. You should have been there.
We should have brought him because
Yeah. So what is 1991? First edition of the obesity surgery journal. Okay, any, where, Mina?
Obesity genetics 200.
Obesity genetics 200. This rare inherited obesity disorder can be treated with setmelanotide. Yalla. You have chosen. Any takers? Any takers from the audience? Exactly. It was in the talk this morning, you know? What is the what is melanocortic 4 receptor deficiency, MC4 deficiency? So the answer is, what is melanocortic 4 receptor deficiency? Home screen. Go ahead, Mina.
Small molecule 200.
Small molecules 200. Stimulate hunger receptors and has a diabetogenic effect. Okay, Antonio.
No, it was wrongly pressed, but anyway. I don't know.
That is incorrect. And yeah, go ahead, Mina.
What's leptin? What is leptin?
That is incorrect also. Hunger. Secreted from gastric fundus. Okay, the koala team.
What is ghrelin?
What is ghrelin? That is correct. Good job. So the koala team get 200, still in the minus. The koala team. Good job. Okay, koala team. Koala team.
Complications 100.
Complications 100. Management options of this complication. Okay, Antonio.
What is endoscopic taking out of banding?
That's correct. What is endoscopic or laparoscopic removal of band, eroded band? That's correct. Good job. Antonio, or the Mediterranean.
What about obesity surgery journal 100?
Obesity Surgery Journal 100. The current international publisher of Obesity Surgery Journal. Okay, Mediterranean.
What is Springer?
Springer Science, that is correct. What is Springer Science? That is correct. Good, Mediterranean get 100. So Mediterranean get 100. Can you correct the answer, the screen?
200.
Okay, Mediterranean.
Bariatric procedures, 100.
Bariatric procedures 100. Most deadly complication of this procedure used to treat morbid obesity in 1960s. Okay, Antonio, easy on the buzzer.
What is proteic malnutrition?
What is?
What is caloric protein malnutrition?
I would say this is incorrect.
Okay.
This is a jejunal-ileal bypass. Okay, the Mina.
What is liver failure?
What is acute liver failure? That is correct. What is acute liver failure? That's correct. Good job, Mina.
Yes. But this is due to, the acute failure is due to proteic caloric malnutrition.
Yeah, but they will die from the acute liver failure.
It's a consequence. But anyway,
I'll leave it to the judges.
The judge can decide that.
Liver failure. So they agreed liver failure. Okay.
Celebrities and bariatric 100.
Celebrities and bariatric 100. Bariatric procedure done for this celebrity. Guys, Maria Curry. Yeah.
What's sleeve gastrectomy?
What is laparoscopic sleeve gastrectomy? That's correct. The Mina, that's correct. Good job, Mina. Okay, Mina.
Obesity genetics.
100. Obesity genetics 100. Most common monogenic causes of obesity. Also, what this morning, it's been discussed. Okay, what's the POMC definitions? POMC definitions. Deficiency. So the answer is what's POMC? Deficiency. Okay, and the last question is small molecules 100 has insulin sensitizing and anti-inflammatory effect. Hit 2 clicks, please. Secreted, most abundant peptide secreted by adipose tissue. Okay, go ahead.
What is adipokine?
That is correct. What is adiponectin? That's correct. Good job. So now you're positive 100. Good job, Mediterranean. So we have now the Mina 1600 for the consultants, and we have the permits in the context for the third player. So the permits. So thank you guys. We have the last round now between fellows and consultants. We need the permits team. Where's the permits team?
Thank you very much.
Where did Mustafa go?
Thanks.
Here's our categories for the third round. History of bariatric surgery. Bariatric surgery outcomes. procedures, bariatric surgery scores, endoscopic management of obesity, obesity in TV and movies. Good. Okay, we'll go with the permits. Can you choose? On the mic, please. And don't Google things.
Endoscopic 300.
Endoscopic 300. Endoscopic 300. Can you choose endoscopic 300, please? Management of these complications of intragastric balloon. And you have to answer in a question format, please. Okay, in a question format.
Yeah, what's laparoscopic removal of the balloon?
What is laparoscopic removal of a balloon? That is correct. That is correct. So the balloon is causing bowel obstruction right there. That is correct. What is laparoscopic removal of the balloon? Good job. Okay, Mina.
History of bariatric 300.
History of bariatric surgery 300. What was that again? So the first to point the beneficial effect of bariatric surgery on type 2 diabetes in this landmark paper. Sorry. Go ahead.
Walter
You have to
Porras.
press.
Who is Walter Porras?
Who is Dr. Walter Porras? That is correct. That is correct. Good job. Who is Dr. Walter Porras? Good job. Okay, Mina.
New procedure 500.
New procedures 400. The first to report technical details of this procedure. Okay, pyramids.
Professor Matthews Phobos.
Who's what?
Professor Matthews Phobos.
That is incorrect.
Phobos.
What was that?
Phobie.
Yeah.
Yeah.
What did he say? Who's Dr. Matthias Phobos? Okay, that's correct. Who's Dr. Matthias Phobos? That is correct. So you get 400. Okay, permits. Permits?
Obesity in TV movies 300.
Obesity in TV movies 300. Can you play the movie, please? Name the movie, and you have to be on the question format. Can you play the movie, please?
This is a fair acceptance group.
I know.
But you're not fat.
No. Hi, I'm Darcy. I'm a recovering anorexic. Hi, Darcy.
Any taker? Okay, any taker? The answer, what is disfigured? What is disfigured? So she was in a support group. She's anorexic. She went to an obesity support group. So the answer is, what is disfigured? Show us the answer, please. What is disfigured? Okay, nobody took it. Back to the home screen, please. Pyramids.
Endoscopic 400.
Endoscopic procedures 400. Endoscopic procedures commercially popularized has conflicting results for weight loss compared to placebo in a randomized controlled trial. Pyramids.
Intragastric. What is intragastric Botox?
What is intragastric Botox injection? That is correct. That is correct. Gastric Botox injection. Good job, pyramids. Gastric Botox.
He said pose.
Pose or Botox?
Botox.
Botox. He said Botox.
Oh, I thought he said pose.
No, Botox. Okay, go ahead. Pyramids.
Movies 200.
Movies 200. Name the movie. Can you get the movie going, please?
For Professor Sherman Klump, being the big man on campus was no laughing matter.
What's his... down with it here, Jimmy Hopper.
You got to work out. You got to bust a swift. Exercise.
Here we go. 1, 2.
His body was disproportionate.
Anything I can get for you? Juice, coffee, rack of lamb?
His family was dysfunctional.
I don't know why everybody trying to lose weight in the first place. You're talking about that's healthy. I know what healthy is.
And his love life
I'm a big fan.
Thank you very much. I'm flattered. Flattered.
was disastrous. For the thinner.
Okay, so we have a taker here.
What is the Nutty Professor?
What is the Nutty Professor? That is correct. What is Nutty Professor movie? That's correct. Eddie Murphy. Okay, Mina.
Bariatric outcome 300.
Bariatric outcomes 300. The rate of type 2 diabetes remission with intensive medical therapy according to the STAMD trial. Okay, permits.
5%.
What's that?
5%.
That is incorrect. With intensive medical therapy, type 2 diabetes remission. Any takers? Okay, Dr. Shawar, you want to answer? What is 0? No remissions with intensive medical therapy. So what is 0%? Okay, go ahead. Who's okay? Mina.
Scores 300.
Scores 300. Scoring system to standardize reporting of bariatric surgery outcomes. Hit 2 clicks, please. 2 clicks. It consists of weight loss, improvement of comorbidities, complications, quality of life, and need for new surgeries. Any takers of this scoring system? You can hit the bottom if you know. Okay,
Bariatric reporting analysis of outcome score.
That is BER score. What is BER score? That is correct. Good job. Good job, Pyramid. What is bariatric and reporting outcome score? BER score. Good job. Good job, Pyramids. Pyramids. Pick and choose. Pyramids.
History of bariatric 200.
History of bariatric 200. The surgeon who invented this procedure. Dr. Shawar wants to answer. Any take? Okay, Mina.
Who is Nicolas Cubinaro?
Who is Dr. Nicolas Cubinaro? That is correct. That is correct. Good job. Okay, Mina.
Scores 400.
Scores 400. Scoring system developed in UK for selecting patients for consideration of bariatric surgery. Hit 2 clicks, please. Based on BMI, age, severity of comorbidities. Any takers? Any takers? The answer is, what is Dubasco score? Dubasco score. Can you show the answer, please? What is Dudley bariatric surgery and comorbidity score? Dubasco score. Okay, let's go back to the home screen. I think Mina.
New procedures 500.
New procedures 500. Revisional procedure for this revision for Roux gas bypass. Okay, pyramids.
What is Roux-en-Y distalization?
What is Roux-en-Y distalization? That is incorrect. There are types of distalization.
Type 2.
Well, it's too late for you.
What's type 2 distalization?
That is type 2 distalization. That is correct. That's correct. What is type 2 distalization for the Mina? Okay, Mina.
Bariatric outcome 500.
Bariatric outcomes 500. The rate of resolution of hypertension after bariatric surgery according to a meta-analysis by Botschult in 2004. Hypertension resolution, and this very famous meta-analysis. Oh, no, you can't. Any takers from the audience? What is 60%? What is 60%? Okay, Mina, 60% resolution of hypertension in this meta-analysis.
History of bariatric 500.
History of bariatric what?
500.
500. Year new IFSO ASMBC guidelines for bariatric surgery indications. Okay, that's a landmark history. Go ahead.
2022. What is 2022?
What is 2022? That is correct. Good job. Good job, Mina.
They didn't say what it in the first.
I said what it.
No, they didn't say.
No, we said
They
so.
didn't say.
No.
They didn't
No,
say.
it's not like that.
Be fair.
Be fair.
He said it.
Be fair.
They didn't say.
Be fair.
They corrected themselves.
No.
Yeah.
We
So I have the
corrected
judges here. They
ourselves.
can solve the conflict. You can on the mic.
I think we decided yes, the answer is correct.
The answer is correct. Okay, we have the Mina again.
History of bariatric 400.
History of bariatric 400. The first who performed this procedure laparoscopically. Any taker. Mina.
Who is Kelvin Higa?
What's that?
Who is Kelvin Higa?
That is incorrect. So Mina lose 400. Any taker? Audience? Who's Dr. Alan Whitgrove? Who's Dr. Alan Whitgrove?
Correction,
Yeah?
Woodgrove and Clark.
And Clark.
They
Okay.
both did it.
Good. They're combinations.
We should give it to them.
Yeah. They answered incorrect. So, good job. Okay. So who's? I think Mina.
Bariatric outcome 400.
Bariatric outcomes 400. The overall reduction of all-cause mortality after bariatric surgery.
What is 40%?
That is correct. What is 40%? Good job, Permits. Good job. Good job. Go ahead, Permits.
New procedures 300.
New procedures 300. Name the procedure. Okay, the Mina.
What is SASI procedure?
What is
Single anastomosis, sleeve ilial bypass.
sleeve ilial? That is correct. That is correct. Good job. Okay, Mina.
Endoscopic 500.
Endoscopic 500. So this is a day double. If you get it correct, you get 1,000. If it's incorrect, you lose. Show us the answer, please. Most effective endoscopic procedure for weight loss with significant learning curve. Any takers? Okay, in a question format, please.
What is ESG, endoscopic sleeve? What is ESG?
That is correct. What is endoscopic sleeve gastroplasty? Good job. So you get 1,000. Good job. Okay, Mina.
Scores 500.
Scores 500. Bariatric surgeon developed and popularized a scoring system to help surgeons choose among Roux-en-Y and sleeve gastrectomy for obesity with type 2 diabetes. A bariatric surgeon. Any takers? Well, he works with Dr. Shower. Used to work with Dr. Shower. I know you know that. The individualized metabolic score. Any takers? He's from Iran. Any takers? Who's Dr. Ali Aminian? Who's Dr. Ali Aminian?
Ali Minion.
Ali Aminian. Yep, Ali Aminian. Okay, we go back to the, I think, Mina. Mina.
Obesity in TV and movies 500.
Obesity in movies 500. Name the movie. Can you please turn the movie on, please?
Thank you. I'm good. She's fat, dude. I'm not into her.
You're fat.
We don't say that to our friends.
This is a food chart that I use with all of my patients. How does this look to you?
Where would a burrito fit into that? I can't want a hot girl.
Of course you can want a hot girl.
Oh.
I'm sorry. I went over to Melanie's house a few nights ago.
Honey takers?
I was totally in love with her,
No,
man.
you weren't.
No, you weren't.
You were addicted to her.
I know you got a trainer. How's that going?
He quit.
Why?
He's a quitter, I guess. I didn't sign up for this.
I wanted to make sure you weren't dead or something.
Oh, I'm not dead. Newsflash, fat people aren't into fat people. We're mutually disgusted by one another.
Are you in denial or something?
What do you mean?
I'm not sure if I can do this on my own.
You might want
Honey
to look into
takers,
Overeaters
you can end the movie here.
Pushing me, man! When was the last time you dealt with being fat, Aaron? Huh? Well, I probably am crazy. I'm gonna eat this whole pizza by myself. There's nobody else here. It's always just me. I don't want to die like this, Jerry.
Okay, any taker? No? Any taker? So the answer is what is fat? The movie name is What is Fat? Fat. Okay, go ahead to go ahead to the answer, please. What is fat? Okay, a home screen. Mina?
TV and movies 400.
TV and movies 400. In this movie, Morgan Spurlock personally explores the consequences on his health of a diet of slowly McDonald's food for 1 month. You can play the movie.
Yeah, can I get the double quarter pounder with cheese meal? I think I'm gonna have to go supersize.
It's hard for me to watch him go through this.
So it seems like you're starting to get addicted to it now.
You saw these numbers, right? These numbers are outrageous.
Unfortunately, you cause some major harm to your heart, your liver, your blood.
You're gonna die. You'll die. I want more. You gotta stop.
Okay, any takers? What is supersize me?
Supersize me.
What is supersize me?
He just died, by the way.
He just died? I'm sorry. Okay, go ahead to the answer.
Yeah, can I get...
What is supersize me? And then we'll go back to the main home screen. Mina?
Endoscopic 200.
Endoscopic procedures 200. Intragastric balloon system with ability to adjust intragastric balloon volume. Okay, Mina.
What is the SPAT system?
That is correct. What is SPAT's balloon system? That's correct. Good job, Mina. Mina, home screen, please.
Scores 200.
Scores 200. Scoring system to predict remission of type 2 diabetes after bariatric surgery. Hit 2 clicks, please. Predict remissions. It consists of age, BMI, C-peptide, and duration.
And the medication, the number of medications.
No, it's not the number of medications in the scoring system. That's predict remission. It's different than trying to choose the procedure. Okay, permit.
What is ABCD score?
That is correct. What is ABCD score system? Good job. Good job. Okay, permits. Good job, permits.
Scores 100.
Scores 100. Scoring system to assess for obstructive sleep apnea. Okay, permits.
Stop bank score.
What is
stop bank score?
What is stop bank score? That is correct. Good job. Good job, permits. What is stop bank score? Okay. Permits.
Bariatric outcome 200.
Bariatric outcome 200. Definition of failure of weight loss after bariatric surgery. Most commonly used definition. Okay, permits.
Excess weight loss less than 50% after 2 years from the surgery.
That is correct. What is less than 50% excess weight loss after 2 years of bariatric surgery? Good job. Good job, permits. Permits, go ahead.
Endoscopic 100.
Endoscopic 100. Expected duration of ellipse, swallowable gastric balloon. Okay, permits, what is?
What is 4 months? What is 4 months?
That is correct. What is 3.5 to 4 months? Good job, permits. Okay, permits.
There's no point.
We're waiting for you to run the question.
No, there will be like a final question where you have to bet on what you have. There's final Jeopardy question here.
So if they have a lot to bid on?
Yes. Go ahead. Permit.
Bariatric outcome 100.
Bariatric outcome 100. The 10-year remission rate of type 2 diabetes according to the SOS study. 10-year remission of type 2 diabetes, the Swedish obesity subject study. Any takers? Any takers? And the correct answer is what is 36%? It's 36% remission rate at 10 years of type 2 diabetes. Go to the home screen, permits.
New procedures 200.
New procedures 200. The year this procedure was approved by ASMBS. Okay, Mina?
2020. What's 2022?
What is 2022? That's correct. Good job. Good job, Mina. Mina?
New procedure 100.
New procedures 100. The surgeon who invented this procedure. Okay.
Who is David Nuka?
Who's David Nuka? That is correct. Who's Dr. David Nuka? That's correct. The end sleeve. Okay, Mina.
TV and movies 100.
TV and movies 100. Name this show. Can you please play the show?
Every single thing we do is to get you ready for your life
Mina.
at home.
What is the biggest loser?
What is the biggest loser? That is correct. The biggest loser show. Good job. And then the last question is history of bariatric surgery. The surgeon behind the final version of this procedure. Who is? Yeah?
Who is Cabela?
That is incorrect. So you lose 100. Who's Dr. Edward Mason? That is the correct answer. Well, I don't think we have to play the final Jeopardy. Basically, we have the Mina team, 3400s, and we have the Pyramids 1400s. And thank you very much, guys, for attending this session. And you guys get free tickets for the registration for next IFSO. Thank you very much.